order. As has always stated, this meeting is being held virtually. People may participate by calling in with the number that was on the agenda. And we can, the standard disclaimer. So with that, we'll make as many accommodations as we can for folks to be able to make sure that they can participate. So in starting as normal, since the meeting is being conducted virtually, Mr. Kompotek will be assisting us in conducting the roll call votes for each item that we will be discussing today. And please respond with yes or no, and we'll make sure that that gets recorded appropriately. So with that, Mr. Kompotek, I'll have Ms. Jones call the roll for us, please. Thank you.
Thank you, Madam Chair. Senator Brooks.
Here.
Senator Cancella.
Here.
Senator Dennis.
Here.
Senator Goycochea.
Here.
Senator Kieckeffer.
Here.
Senator Parks.
Yes.
Senator Settlemeyer.
Here.
Vice Chair Woodhouse.
Here.
Assemblywoman Benitez Thompson.
Here.
Assemblyman Frierson.
Here.
Assemblyman Levitt for Assemblyman Hambrick.
Here.
Assemblywoman Howdigi.
Here.
Assemblyman Kramer.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblywoman Neal.
Here.
Assemblywoman Spiegel.
Here.
Assemblywoman Monk.
Here.
Assemblywoman Swank.
Here.
Assemblywoman Backus.
Present.
Assemblywoman Titus.
Here.
Assemblyman Roberts for Assemblyman Reeler.
Here.
Chairwoman Carlton.
And I am here. Thank you very much, Ms. Jones, for that. We will go ahead and open up this meeting with public comment. As published on the agenda, public comment may be made by mail, email, submitted by fax, or by calling in to the number designated on the agenda. Due to time constraints, we are going to be limiting public comment at the beginning of the meeting to approximately 45 minutes, and we will limit each speaker to 2 minutes. With that, we will give Broadcast Services a moment to open up the public comment line, and we will go ahead and take public comment.
Thank you, Chair. Caller with the last 3 digits of 692. Please slowly state and spell your name for the record. You have 2 minutes. Please press *6 and begin. Caller with the last 3 digits of 692, please press *6 to unmute yourself and begin. Caller with the last 3 digits of 692, we see you are unmuted but cannot hear you. All right, we're moving on to the next caller. Caller with the last 3 digits of 858, please slowly state and spell your name for the record. You have 2 minutes. Please press *6 to unmute and begin.
Good afternoon. Can you hear me?
Yes, please go ahead.
Fantastic. Hi, my name is Michael Fried, Michaelfried. I'm the Chief Information Officer for the Baltimore City Health Department and calling to voice my experience and recommendation for EMOCA. And we've had an extremely positive experience. We've used them for over 6 years now. We've used them for direct observation therapy within our clinics to see over 500 patients. We recently have partnered with the city, have helped facilitate a partnership with the broad city of Baltimore for EMOCA to do symptom tracking for return to work. There's currently over 2,000 city employees on that platform and ramping up to 7,000. They've been, throughout the years, just a fantastic partner to work with, both flexible, very responsive, extremely customer focused, and have been great stewards of some very sensitive information that we store. So they've been both a great collaborator as well as a really fantastic partner. So just calling to voice our general support as well as a very strong positive recommendation for the organization in general. With that, I'll conclude my comments.
Thank you.
Caller with the last 3 digits of 097. Please slowly state and spell your name for the record. You'll have 2 minutes. Please press *6 to unmute and begin. Caller with the last 3 digits of 097. Please press *6 to unmute yourself and begin. Moving on to the next caller. Caller with the last 3 digits of 010. Please slowly state and spell your name for the record. You'll have 2 minutes. Please press *6 to unmute yourself and begin.
My name is John Vellardita, John Vellardita. I represent 18,000 educators with the Clark County Education Association. I'm speaking in support of your agenda item C1, educator effectiveness. Essentially, this is a safety testing, contact tracing, and screening program for all 17 school districts in the state, along with the public school charter. We're not going to open up these schools unless we have a robust, comprehensive safety program in place. This is one of them. It has testing upon entry. It has quarantine and isolation measures. It has contact tracing. It has all the personal protective equipment, et cetera. This is a program that we personally have been working on for several weeks. We've been part of this task force that has been created to try to bring something into the schools. We're not going to open these schools up without this kind of program. Teachers are not going to go back unless they feel safe. Since March, since COVID hit, we've had 731 of our educators tested in Clark County. 599 of them have tested positive for COVID. 81 have been hospitalized. And this has been done before we even open up the schools. And so I would urge that this committee listen and ask the appropriate questions and support this measure, move these federal dollars so that we can begin a program to reopen these schools, but it can't happen unless they're safe, and the first order of business of making them safe is having a robust safety testing and screening program in place. Thank you very much.
Thank you. Caller with the last 3 digits of 692. Please slowly state and spell your name for the record. You'll have 2 minutes. Please press *6 now to unmute yourself and begin.
Hello, can you hear me?
We can hear you. Please go ahead.
Okay, thank you. For the record, my name is Mary Przinski, MaryPierczynski, and I'm representing the Nevada Association of School Superintendents. And NAS is composed of the 17 superintendents representing the 17 public school districts in the state. This morning at the NAS monthly meeting, the superintendents voted unanimously to support item C number 1 on the agenda to fund a contract to implement the task force initiative for educators' safety screening. The superintendents understand that the COVID testing is voluntary on the part of the employees. Thank you.
Thank you. Caller with the last 3 digits of 097. Please slowly state and spell your name for the record. You'll have 2 minutes. Please press *6 now to unmute yourself and begin.
Good afternoon, Madam Chair, members of the Interim Finance Committee. For the record, my name is Brad Keating.
Brad Keating, Keating, with the Clark County School District. I'm here to speak in support of Agenda Item C1 to implement the Task Force Initiative for Educator Safety and Screening. CCSD supports this effort to ensure our teachers are able to get the testing needed before they return to work in person. Our teachers will be able to feel safe in the classrooms knowing that they can get proper testing and with systems monitoring in place to help make sure our staff can get important real-time information. We need this in place because while right now we only have a few of our rural schools attending in person, this funding for comprehensive testing and monitoring will be important in our efforts to eventually return to in-person classes. This funding is also incredibly important as it supports all of our staff, including those out in the field right now. From our bus drivers who can help connect our community with mobile hotspots, our food service workers out every day at food sites ensuring that children in our community have access to meals, our dedicated and hardworking principals that are running their school sites every day in person, to our teams that will provide wellness checks for the students most in need. They will be able to now have a greater sense of security as they continue to serve our students. We want to thank the Teachers Health Trust, CCEA, the Nevada Department of Education, and the Governor's Office for leading this charge on this effort and coordinating to make this happen today, and hope the committee approves this funding today. Thanks for your time and your consideration.
Thank you. Chair Carlton, we have no other callers in the queue at this time.
Thank you very much. So we will go ahead and proceed to our first item on the agenda today, which is item C1, Department of Education, Educator Effectiveness. This is the dollars for the testing. So with that, if we could go ahead and have, I believe Ms. Ebert is going to be speaking with us today.
Good afternoon, Chair Carlton. Thank you, members of the committee. For the record, I'm Joan Ebert, State Superintendent of Public Instruction. As you know, COVID-19 is impacting each community and county in our state differently. As of today, we have 13 of our school districts which have begun school. 4 of our school districts, Elko, Humboldt, Mineral, and White Pine, will reopen next week. And the start dates for our charter schools and the private schools vary across the state. All districts and charter schools have been provided with the COVID-19 outbreak response plans. The reopening plan developed by each district is unique to that district. The reopening plans for individual school districts and charter schools are available on our website for review. These plans may include district-specific information regarding additional safety measures. While there's no single solution to address the needs of Nevada's school districts and charter schools during this unprecedented time, we are working closely with all public and private partners to ensure needed resources and services are available statewide. The state of Nevada has been working with the Teachers Health Trust to develop and administer a COVID testing program, also referred to as the Task Force Initiative for Educator Safety and Screening, or TIES. The TIES program will provide free COVID testing for all participating teachers, administrators, and staff across the state to help prevent an introduction and spread of COVID into our schools. TIES will also provide free testing through the end of this calendar year to participants who have COVID symptoms or who have been in close contact with someone who has tested positive for COVID. As part of the program, a mobile app will be provided to help people assess their COVID-related health risks, track their symptoms, and communicate with the appropriate entities. After consultation with district superintendents statewide, the Nevada Department of Education collaborated with the Teachers Health Trust to expand the program's scope beyond the Clark County School District. I am pleased to share that at the meeting, as testified by Ms. Brzezinski earlier, that the Nevada Association of School Superintendents voted unanimously in support of this request. In addition, we're proud that the program will serve not only our educators, but also our support staff, which includes our bus drivers, our food service, and additional staff. Before it was submitted for your consideration, the TIES program was reviewed by the state chief medical officer and the COVID-19 response director, Caleb Cage. With assistance from the governor's finance office, the program costs were confirmed to be in alignment with similar efforts being undertaken in this state. While it's difficult to predict the impact of COVID-19 on our state in the months to come, NDE, like all essential agencies, will continue to collaborate with our public health experts to monitor the prevalence of COVID-19 in our schools and communities. NDE remains steadfast in tracking all available financial resources that can be leveraged to support response and mitigation efforts to our P12 school settings. In an effort to provide a complete and accurate, to provide all of you and our public with complete and accurate answers to the questions you may have, I have with me today Deputy Superintendent Gonzalez and Deputy Superintendent Heidi Hartz. They are also joined by Michael Skolnick of the Teachers Health Trust. Thank you for your time. And we're ready to answer any questions you may have.
Thank you. Are there any other comments from the rest of the presenters before we go to questions?
I do not believe so, Madam Chair.
Okay, that sounds great. I think I would like to start with one. If I do remember correctly, there was discussions about this earlier in the summer, and I believe the request was going to be between $13 and $14 million to do this work just in Clark County. And now I see the request is at 13.2, and it's for the whole state. So could someone address the difference there? And if I'm misremembering, please correct me.
Madam Chair, for the record, Joan Ebert, State Superintendent, you are correct in the tracking of how the evolution of a lot of things across our state. Specifically to this project, it was brought forward as just the educators in Clark County. And when I say educators in that instance, I would say it was just the teachers. And it was a process to expand it across and provide the same support for all staff across our state. The initial estimate, I believe you're correct. I would have to go back and look in my records for that specific in CCSD was around that number. But what we did is we worked, and also the pricing evolved. We worked with the Teachers Health Trust. We also worked with the governor's finance office to make sure that the similar programs across our state, those costs were in alignment. And so as you have before you today, we're pleased to say that the cost, projected cost, is the $13 million that you have before you for all staff, education staff across our state.
Thank you, and we do appreciate the fact that this has become a statewide program. That's very good to hear. If I could ask someone to go through the different phases first, and then I do have a number of folks who would like to ask questions, but I think it'll be important for for folks listening and for the committee to go through phase 1, outreach and launch, which is, I believe, September all the way through the year. Phase 2, the testing, and then phase 3, the program monitoring. If you just give us a real high-level overview of each one of those phases, please.
Good afternoon. This is Felicia Gonzalez, Deputy Superintendent for the Nevada Department of Education. Chair Carlton and members of the committee, it's my pleasure to go through the four steps that will happen. The very first phase will begin with program outreach to all participants. That will include all program participants doing they will utilize a tool. It's called the AMOCA app, and they'll use that tool to complete a risk survey. This will provide risk assessment data, and it will build risk stratification model for all participants. Then once people are, all the participants are registered in there, the next part would be for the coordination of testing for all educators across our state. the Teacher Health Trust has communicated that they have already started working with UMC to secure a large testing site and to utilize their 10 UMC clinics across the Clark County and Las Vegas Valley to conduct mass testing, because there are 40,000 plus employees in Clark County. They will also secure a similar type of site in Washoe. And for the rural counties, they will do their initial testing by sending out mobile teams with phlebotomists. They will work directly with the district superintendents and the charter school leaders to coordinate testing sites, whether it be at a school location or at a fire station or wherever they designate is the most appropriate place. And for those participants that can't, that are in extremely rural areas, there is a mail-in option for employees to mail in their test kits so that everybody has access to the testing. From there, there will be ongoing monitoring. Educators through the app will have educator daily check-ins. There will be daily screenings through the app, and data will be provided to every district so that they have the data. The program management team from the TIES group will be able to help manage the data that will be going to the district. There will, and with the school launch, the TIES team, the program manager, they'll be providing ongoing support and personalization to all educators across the state. So that is a very quick overview. And I also want to say that there will be ongoing retesting as necessary for all participants. If an employee does indicate that they're experiencing any symptoms, that's when the program management team will reach out to that individual to either coordinate them going to a testing site to be retested, or if they're in a rural area, they will immediately provide them a mail-in kit so that they can retest. And there is no specific limit to how many times an employee can retest, because as we know, sometimes it may be necessary to have multiple tests. Thank you.
Okay, thank you very much. I'll go ahead and open it up. I have a number of people in the queue. So as folks have reached out, I'll go ahead and start calling on them. Senator Woodhouse, I believe you're first.
Thank you, Madam Chair. And I appreciate the remarks provided by Superintendent Ebert and Ms. Gonzalez, because they answered 2 or 3 of my first ones. So I'll move on to a couple of others that I have. This program is scheduled to go through December 31st of 2020. So if COVID-19 testing and monitoring is required beyond that date, how are you anticipating that we can carry out that effort with our CARES Act funding and for the TIES program will have ended by December 31st? So that's my first question.
Thank you, Senator Woodhouse, members of the committee. For the record, Joan Ebert. The dollars that are made available today are the CARES dollars that do expire on December 30th, as you noted. We continue to monitor and push and pull and support our colleagues in the health agency. So our Department of Health and Human Services, as well as all of the medical experts in the 4 various areas of our state. So as all of you, with watching the financial resources that we hope will be available in the future, we continue to move in that direction. But I think what's important to follow is that we're in constant communication to make sure there is no duplicative resources that are used, right? We have scarce resources and we want to make sure they're used efficiently and effectively, as well as keeping our eye out on the virus and what may transpire. So working with our health officials beyond the 30th is definitely on our mind, as it is yours as well.
Thank you very much for that response. And your last few sentences answered my next question I was going to ask, because I was concerned about any duplication that we might have with the Division of Public and Behavioral Health and others throughout our state that are providing screening and testing and tracing, because we certainly don't have enough money in order to duplicate all of this. So I'm comfortable there. Do you have any other additional things that you can add regarding how you're going to reach out to the teachers across the state? I know here in Clark County, probably it might be a little easier other than the fact that it's really big and there's a lot of teachers and educational support and administrators to reach out to. But do you have any specific strategies that you're going to use to reach out into the other school districts to make sure that you get those people tested when they need it, and then any contact tracing is done as well?
Thank you, Joan Ebert, for the record. We work very closely with the superintendents, their associations that they work with, and also too, the power of working directly with our teachers. And so as many resources, we know at this point in time that communication is critical. All of our school districts do have communication with all of their staff. As noted earlier, it was wonderful that we had a meeting with all 17 superintendents as well as the State Public Charter School Authority. And so that communication plan, rolling it out, making sure that there's multiple modes, not only through their telephone system that they use normally, their email systems, but social media, and working directly with our staff is what's important. And I believe that we have all of those components in place for those that would like to participate in this program.
Thank you very much. Thank you, Madam Chair. And I know you have other members who want to ask, so I will stop my questions at this point and let others have some time to ask theirs. So thank you.
Thank you very much. So with that, I will go to the Majority Leader, Ms. Benitez Thompson. You had questions?
Thank you so much. And I'll just ask a couple. I know you've got lots of people in the queue. So I kind of wanted to talk a little bit about the suggested program and the cost for the program. I think it looks to be that it would be 13 staff people who would be brought on for the program. Is that into the TIES program? Is that right? Do I have my arithmetic right?
That is correct.
Okay. And so are these existing positions that would be redirected to this, or are these all new hires?
These are new hires, and what I would like to do, if you would like the specifics, is actually turn the time over to Deputy Gonzalez, who can walk through each of those levels of positions and support to make sure, as noted by Senator Woodhouse, communication and rollout. But Deputy Gonzalez, will you please share the specifics on those positions?
Yes, thank you, Felicia Gonzalez, Deputy Superintendent, for the record. We also have Michael Skolnick, the Executive Director from Teachers Health Trust, here on the line, and I will turn this question over to him so he can provide a detail as to each function of the new positions.
Okay, thank you. Michael Skolnick, I'm the CEO for Teachers Health Trust. We have multiple positions, and this is a very fluid type of program. We have an executive director that we brought on who has experience in public health and has been working in the field for a long time. and she's going to be leading the program. We have assistants, we have a few assistants working for her to run the program and supporting that. We have, in addition to that, we're building a team of rural specialists who will be spending time in the field, working to make sure that all of the rural schools and all of the schools that are in pretty hard to reach areas are being tested and tested efficiently. The program managers are dealing with coordinating operations and execution on all the activities. We have 2 of them. I do need to pull up the exact schedule of resources here. Hold on 1 second. But we have, basically fits into 4 areas. It's contact, it's working with the application, it's leading the program, and then supporting the management of the program. It's 6 staff people. Go ahead.
The 13 folks will be brought on, and I know it can be hard to fill positions. It's, of course, this is a really ambitious timeline. Is there anything you want to tell us about tempering expectations in terms of setting up an operation, including 13 new staff to accomplish this? Like what will be, have it all in place, up and running and done by the end of this December?
Sure. No, it's not a problem. We've already hired the executive director. We've already hired the supportive team. We're in the process of finalizing, once approved, with the people that will be doing the phlebotomy or testing in the mobile team that's going to be supporting the rural areas. We're using resources internally who will then be turned over officially to the people we hire. We have about 4 more people in the pipeline. We just do not want to bring them on until we're ready to begin the implementation. But it's not difficult to find people. 1, our team has been working with volunteers in the communities already. 2, we've already started working collaboratively with physicians, with health centers, et cetera. And we've identified people that could support us throughout Clark County and the rest of the state. Did I answer your question, or would you like me to elaborate?
That's all I'm going to do for the moment. Thank you.
Okay, thank you.
So if I understand you correctly, Mr. Skolnick, these folks are already hired. So how long have they been with you so far?
We've had 1 person who's helping to lead the program working with us now for about 4 weeks. She's working right now with us in it seems to be more of a voluntary versus hourly approach. We are compensating her though. She's put in extra hours. We have others who are ready to come on board. We had to hire people to do the front end. We also worked with a public health team that worked with the state of New York and with Los Angeles in helping develop their programs, and with Manat, it's a legal firm and a consulting and a lobbying firm who's been supporting us from the beginning, and we've had 2 of their active leadership. We just realized that if we don't invest in the community now, for 1, it becomes more destructive to the community because we're not on top of the issues. 2, we've been helping teachers. We believe that if we don't get the teachers into the classroom and start supporting it proactively, there will be issues later. So that's how this started. I mean, we've been together since March working on this, and it was out of responsibility versus worrying about the budget on the front end.
Okay, I just wanted to make sure you had it clear that there were a couple still already on. So with that, I believe I can go to Dr. Titus had a question next.
Thank you, Madam Chair. I appreciate the opportunity to ask a question. And I don't want a high level view. I want to get into the weeds. I'm looking at the scope of work document that was sent to us And from the book that I would have, I would say it was page 17. I know the people I'm asking these questions of don't have the book, but for members, they can look at what I'm looking at. There's a lot of tests available now. And I understand from this document that you're going to contract with a lab to be doing this. You're not going to use a state lab. What lab are you using? It's nowhere that I can find.
Oh, University Medical Center in Clark County. They're going to be
So
doing all the information.
You've
Yes.
contracted with the University Medical Center in Las Vegas to do these tests?
Yes,
And-
they have the fastest turnaround. That's why we're working with them. They have a really
All right,
good
so I need to,
system. Okay, go ahead.
I need to know what type of testing you're doing. I'm hearing words from the Assistant Superintendent Gonzalez that you're sending phlebotomists out. A phlebotomist is somebody who draws blood. Are you doing nasal swabs? Are you doing the rapid testing? Are you doing blood testing? Are you doing antigen testing, antibody testing? What type of testing are you doing?
We are doing, they happen to be phlebotomists, but we're sending people into the market to do what they call molecular diagnostic tests or PCR testing. We are
Okay, so
only
you-
going with scientifically supported at this moment. And we refuse to do anything that's experimental at this point in time.
Okay, there are different types of PCR tests. Which ones are you doing? Are you going to do the rapid ones so that we will get that back? The teacher will know, because the point of this, and I understand your concern, because one of the things that we're looking at doing, if a teacher has this virus, you want to know fairly quickly. There are point in time tests that are available that the test can be done and you can get the test back in 10 minutes. What is your turnaround time going to be when you do these tests? And can you tell me the brand that you're using and what % accuracy is that brand?
That's a good question. Okay. We're using the polymerase PCRs, which is polymerase chain reaction testing. Turnaround time is 24 to 48 hours, and they're the most accurate tests on the market. And there is nothing more accurate than what we're using that exists today. I believe the accuracy is, I'm trying to remember because I did not write down that number, but it's in the highest 99 point something accurate, 99.7% accurate, but I'll get you the exact numbers in about 2 seconds.
So you're telling me the test is 99% accurate. It is a nasal swab or is it the nasal oral swab? Do you know?
It's the nasal swab.
Okay. And they're guaranteeing you it's going to be back in 48 hours?
Oh, yes. We've been testing teachers and tested the program so far just to see the timing. We haven't had one test back in less than 15 hours. So we're guaranteed contractually 48 hours. So there's not an issue there.
Okay. And so this additional 40, let's see, you have 62,000 potential participants. So this sudden flood of 62,000 more tests on top of what they've been doing will not overwhelm or duplicate or shut down the system?
No, it won't. And by the way, your accuracy test, it's 99 for both, above 99 for both sensitivity and specificity.
Right. I mean, it's encouraging. And then you are, the next question I have, thank you for that. If I might, Madam Chair, continue.
Sure, go ahead.
So on your list, you have down initially 62,000 tests initially. There was a mention that you had 40,000 employees, teachers plus employees in Clark County. So I'm wondering if the 62,000 will include, because I keep hearing, and sometimes I'm hearing the words teachers, and then I hear the words educators, and then briefly I heard somebody mention support staff. So will all bus drivers in the state of Nevada be offered this test? Will all teachers, will all secretaries, will all folks who come in contact with students be offered these tests? And do you have a number? I'm thinking your 62,000 may be low.
Well, I've received the numbers from the Department of Education. They are accurate. It's 62,000. If it's more, it's more, but that's what they've given us to date. I believe those numbers are correct, which includes substitutes too, which I didn't hear you mention, as well as the bus drivers, as well as the staff and all educators. I do use the words interchangeably, so I apologize for the confusion there.
Okay, and then the next question I had on that same piece of paper that I'm looking at, when you're monitoring folks, you have they've agreed to give you 93,000, and I'm just wondering the difference in those numbers. Are you looking at, because there's the theory from the CDC has changed regarding retesting, follow-up testing, and those kind of things. Can you explain the difference in numbers?
Can you say that one more time? I apologize.
All right, the original, on line 1, you're asking, or line 2 of this thing, you're asking for 62,000 or 62,000 participants, but then you have the next one for follow-up 93,000.
So we're averaging about, we put an estimation in of 2.5 tests per person. If it's less, there's budget that will be used. If it's more, it's at our risk at this point.
Right. So can you give me a breakdown on what you've contracted with the lab at the University of Nevada, Las Vegas Medical School. Can you tell me what they're charging you per test?
Yes, it's $70 a test. When the initial, somebody asked earlier about the higher costs that were involved on the front end tests at that point. When we did the initial estimate, we're at 120. UMC has given us pretty much the discounted rate that they can give us, including using the convention center and a lot of the facilities that we're going to have to use in order to actually do the testing.
All right, so they're charging, it's breaking down to about $70 per test. That includes the initial test. And are any of their staff involved in any of this collection? And do they have enough staff to be actually processing these tests? Because one of the things at the state level, and one of the things we had to have the National Guard come out for, was the actual data entry, those kind of things. So are you hiring staff not for the collection, but you're hiring staff for the data entry and the follow and the mobile app? Is that where your staff is coming in versus your contract with the university's medical school?
It's a combination. You got it right. But they have adequate staff. They can handle 4,000 tests a day at this point for us. And they're committed to that at this point. We have a team, we have people that are going to be working on the app, working on contacting members. If they're in isolation, we actually have the backup to support them. We have a badge that they'll be receiving. I think it's in your packet where it explains the Amoka app. So we have all of that integrated into the support staff.
Okay, so just doing the math of 4,000 tests a day and 65,000 tests, it's only going to take you about 16 days to get that done. Is that correct? Did I do that math correct?
Our goal is to get it done within 2 to 3 weeks. We'd like to begin as soon as possible, and we can do this, yes.
Very good. Okay, well, thank you, Madam. Madam Chair, for the questions, and thank you, sir, for answering them.
Okay, thanks.
Okay. Thank you, Doctor. We can always count on you to get into the weeds with the nuts and bolts of these things. So with that, I'm going to go ahead and go to Senator Kekeffer.
Thank you, Madam Chair. I appreciate it. I appreciate Dr. Titus getting into some of the weeds. I'm going to take a step back, and I'd like to ask what we're trying to sort of accomplish. I've got, looking back at when this originally sort of came out in July, it made a lot of sense to me that we were going to try to test every teacher before we opened schools in August or September. But Clark County School District has now made a statement that they're not going to open schools for 90 days after the start of school. So that puts them out from, if it's August, late August, mid-August, September, October, November, maybe, before they're even planning on considering reopening schools. If we do a snapshot in time now for the sort of infection rate amongst education personnel, that's going to have nothing, it'll have no bearing on what infections are for when schools actually reopen. So unless the Clark County School District is prepared to reverse course and reopen schools based on a low infection rate of teachers if we get these tests back in the next month. So I'm trying to figure out how this is actually going to help reopen schools, which is what it's being pitched to do.
Thank you, Senator. For the record, Joan Ebert. The Clark County School District is actually revisiting their plan at their school board meeting at the end of this month. So there is not a specific date at this point in time that, it's all of this is driven by data. They initially thought they were going to go hybrid, as well as Elko thought they were going to go hybrid in opening schools, and then made the determination to go fully distance at this point in time. But we know that getting our students back into classrooms, getting our teachers in front of those students is a high priority for all of us. And so the school board itself, who is the ultimate decision maker on when students and teachers return for Clark County School District, will be revisiting it at the end of this month.
Thank you. So is the goal then to have all teachers and education personnel tested before the school district meets? And is there a threshold by which they're going to be willing to pull the trigger under the governor's emergency directives over what's an acceptable sort of infection rate amongst education staff to reopen schools in Clark County?
Joan Ebert, for the record. Senator Kekeffer, I am sorry that I'm not able to answer that question for you. I would really need to defer to the Clark County School District, their board of trustees and their superintendent to answer a question like that.
Appreciate that. Let me sort of ask about how this is going to be implemented in, I guess, other parts of the state. I'm maybe one of the lucky ones in that all four of my kids are currently sitting in the classroom in the Washoe County School District. And, I think I like that it's been sort of developed for statewide use if the districts want to use it. I know it's opt-in for them as well as for teachers. So is the idea to get out into individual schools to get these tests done, or is everyone going to be expected to come to one place? How is that going to be accomplished for a large school district?
Yeah, and I will defer those specifics to Mr. Skolnick.
The specifics are is that we will get a list of every single teacher from the school district, from the Department of Education in each of the districts. Every teacher will receive an email with an application, and the first thing we'll do is the stratification, get information on them, make sure they find out if they have any health issues that would impact them so we know their risk level. Stratification is important. Monitoring is important, and testing. So we have the testing beginning. First they do the app, and then we set up the test. They'll know when their appointment is. They'll be able to make determinations. We'll have everything set up, and they will then get the testing. The results will be back to them in their application and via a medical record connection from Epic systems that UMC uses. Any questions?
So where are you going to actually collect a sample from teachers?
Where we will do collections at the schools. We have 9 centers in Clark County. We have the convention center set up 7 days a week for the collections. And we're going to be doing testing with individual testing centers, or what they call reference labs, throughout the state. And then we have mobile folks for the rural areas that will be working with UMC and testing rurally. We're going to coordinate with all of the superintendents. Everything is well coordinated. Everything will be managed very effectively.
Okay, so the all right, Madam Chair, I'll leave it there. Thanks.
Okay, thank you, Senator Kekeffer. If you need me to come back around, this is a very important issue to all the teachers and all the folks that are in our schools in the whole state. So we want to give it its due. Ms. Monroe Moreno, did you have a question, or did it already get answered?
Thank you, Madam Chair. And I believe most of it was answered. So in Clark County, as Senator Kekeffer said, our children are home. Right now, today, I'm multitasking, doing IFC and digital classroom with my grandchildren. But I know that a number of teachers in my district and in the school district are concerned about having a safe environment to return to school in a few months. So if I look at the timeline correctly, and please let me know if I am looking at it correctly, those teachers here in Clark County do not have to be tested next week. They could go closer to the reopening time, which would be later September, October, to have their tests conducted to make it closer to the time for them to actually go into the classroom to ensure the safety of themselves and staff and the students. Is that correct? Am I reading that correct?
Thank you, Assemblywoman Joan Ebert. For the record, yes, you are correct in exactly that. They can coordinate the timing of school and testing together.
Thank you, Madam Chair.
Thank you, Ms. Member Moreno. Senator Settlemyer?
Thank you, Madam Chair. I had a few questions. What's the plan? So the desire, of course, is that all teachers will be tested or staff will be tested prior to the students going back to school in the areas that have not yet gone back to school. And then is there a plan to have retesting, or is it just going to be as needed based upon contact tracing?
This is Felicia Gonzalez, Deputy Superintendent, for the record. Thank you for the question. So the answer is yes, there is a plan for retesting, and retesting can be based, there's not going to be another large event where everybody gets retested. Retesting can be done individually and based upon the need of a district, of a school, or of an individual.
And will the testing to begin with be required, or is it just going to be voluntary?
Felicia Gonzalez, Deputy Superintendent, Nevada Department of Education, for the record. The testing will be completely voluntary for all educators, support staff, bus drivers, and substitutes.
Thank you. One last question. I was curious, many of the schools, I look forward to trying to support anything that allows the students to get back to the classroom, to return to a little bit of normalcy. In that respect, you know, I'm fortunate being in Douglas County, and the counties that I represent have all returned back to school, some of them on a hybrid curriculum. Most elementary schools have begun full. In that respect, this was discussed back in July. I remember the first special session saying it was going to be about $13 to $15 million. Why the delay? I mean, we've had schools operating for a while now. Why couldn't we get this program up and running? I mean, to me, this should have been one of our main priorities to get out of the gate. So why the delay?
Thank you, Senator. For the record, Joan Ebert. The timing that it took us to expand once beyond just Clark County, but to expand statewide, as well as working with DHHS and the state chief medical officer, making sure that we were in alignment with the work that has gone on and not duplicative, was important. And then obviously working with the governor's finance office. And as you are well aware, we've had different components, and thank you again for during the special session, the dollars that were made available to support schools also. So all of those moving parts and making sure that we had, that we were diligent in making sure that when we brought to you a complete program, as presented, was important, and that we didn't have pieces left out. And so that's the time to make sure all of those boxes were checked off to be able to bring that proposal to you today. And do I wish it was sped up? Absolutely. But didn't want to miss anything in the process or bring you an incomplete project.
Thank you, Madam Chair.
You're welcome, Senator. I'll go back to Senator Keykeper, just because I want to see that jacket on the screen. So.
Oh, thank you, Madam Chair. I appreciate it. I wanted to follow up on the comment from Ms. Monroe Moreno, because I think it's a really important point. So if we're trying to do this to get a comfort level to bring teachers back into schools and students back into schools, is it not just an option, but will it be implemented in a way to ensure that that timing is synchronized? Because what I'm worried about, frankly, is that we're going to do a bunch of testing right now and spend potentially $8 million on testing that we could be using for other things like tenancy supports that will have no bearing if the Clark County School District doesn't actually reopen schools until January. And at that point, to me, that is not a good use of these dollars. So if, for example, they do go back, and this is the first time that I'm hearing about this, so I'm glad that the Clark County School District has decided to revisit the reopening plan and potentially reopen earlier. But will testing be synchronized with which schools are opening, which grades are opening, things like that, so that there's an alignment between these expenditures and the ultimate goal?
Mr. Skolnick, I have not, that is, excuse me, Joan Ebert for the record. That is absolutely the expectation for all of us. If some of our school districts across our state, and as you noted, elementary school in Washoe is 5 days a week. We have that model also in face-to-face 5 days a week. We still have students in other districts that are in the hybrid piece, and then Clark County will make their determinations. I, again, do not want to speak for the superintendent or the board. It's, as you know, not appropriate. But I don't know if there's other specifics that Mr. Skolnick, that is public knowledge, can share of additional conversations or alignment that you've had with the Clark County School District specifically, is what I hear the senator asking.
What I know from discussions I've had with Clark County School District leadership is that they want to make sure that when teachers come back, they're effectively managing their risk, and they want a model that's agile. So the model is agile, and it will work with teachers as they return. I don't have specifics on when they'll return. I have not met with the Board of Trustees for the school district or the superintendent about timing, only about the testing program. I do know that for a teacher to feel comfortable going back to the classroom, they do need to have the testing. They do need to have the monitoring. We do want to make sure that they understand their risk and that they manage their risk well. And if we don't do that effectively on the front end and make sure that when they come back, they have those opportunities, you're going to be basically rolling the dice as to when teachers end up in the classroom and then when they have to go back home sick because they're not being monitored effectively.
Certainly, Mr. Skolnick, I totally agree that we should be doing everything we can to make sure teachers both feel safe and are safe as they return to the classroom. I think so at least the question, are individual educational personnel going to be self-selecting when they go test, or will they be cleared to get tests based on their re-entry to the classroom?
Okay, I could answer that. We have communications with, as we said earlier, with the superintendents. The superintendents will provide us the names and all the contact information for their staff, and then we will contact the staff, and based on returning the time frame, we will test them appropriately and right away. We have the capabilities to do that.
Maybe I'm not being clear about why I think it matters. If you test everybody right away, but they're not going back to school for 2 months, the test is irrelevant in terms of the reentry plan, right? So,
well, you're basically dealing with a situation where we want to get the teachers ready and effectively able to test, because the school district has a plan so that the teachers can get back into the classroom. Nobody wants to be working from home if they could be in the classroom directly with their students. And so based on the testing program and the timing that we're given by the district superintendents, we can begin immediately. If Clark County decides schools are going back October 15th, we'll begin the testing 2 weeks prior to that. It's more or less based on the district, but we know that the testing is necessary and the monitoring and the stratification, because we know you always need to have a smoke detector, you need to have the alarm, and then you have to be able to put that out through contact tracing, and that's the fire extinguisher, and we're trying to build those three pieces so we can move forward, if that makes sense.
I don't disagree with the need for testing and contact tracing, but I'm hearing mixed messages about when that's going to happen based on school reentry plans.
I can say
okay, thank you, Madam Chair.
If you like, I'll give you a clear answer. The clear answer is 2 weeks prior to returning, we will test the teachers. Okay,
See, now that's not what I heard before. What you said was you were going to give everybody, all the educational personnel, the information, and then it would be opened up for testing automatically and instantaneously. And that's different than 2 weeks before school's open.
So what you heard earlier is that we're going to have an application. That application works for the monitoring. It helps us get information on the teacher and get communications beginning with them. So when they go into the classroom and we have the timing, they will get the testing. Does that help?
Okay, that's what I want. Yes, that's what I want. So testing will be prepared, will be made available 2 weeks prior to returning to class.
Yes.
Okay, thank you. Thank you, Madam Chair.
Thanks for the question.
Thank you, Senator Keffer. Ms. Benita Thompson, did you have a follow-up on something?
I did. So I wanted to talk a little bit about the data and the app. So right now it's participating teachers. So will the participating teachers be any teacher employed anywhere in the state who wants to opt in, or only the folks who are currently right now paying into the Teachers Health Trust?
For the record, Superintendent Ebert, it is available for all staff members. Every single person that is employed by all 17 school districts and the state charter school authority.
So as long as they're going to they would hypothetically go to the physical site, then they could be eligible for it.
That is correct.
Okay. So with this data, who's going to have access to the data? And I'm asking within the context of the conversation up here in Washoe County about, the public feeling that there's, various dashboards and various forms of information, these different metrics that are out there. Sometimes the metrics dovetail, sometimes they don't. Sometimes we don't have a clear answer if they dovetail or if the data is complementary or not. So who would have access to the data? Will the school districts have access to the data? Will the health department have access to the data?
For the record, State Superintendent Joan Ebert, yes, the school districts will have access to the data as well as the health department. Those components were very important to everyone. They will also be following all of the protocols by the health districts as well as Carson City Health Department. So those pieces, again, we wanted to make sure that everything was in alignment. Obviously, the PII information, to that level, and following HIPAA requirements will also transpire.
Okay. And then some districts have already arranged for and paid for testing. I think Washoe County is doing their testing for teachers through Renown and paying that way. Tell me how this makes the best sense versus just doing that, just contracting with the medical facility to hold dollars to be available for these employees to come test.
So statewide, Superintendent Ebert, for the record, statewide, there's various availability and reach to be able to have these tests. So it's important as a statewide entity to make sure that all staff within the school districts were supported and statewide. In the case of a Washoe County School District, they wanted to move forward with the face-to-face, and they were blessed to have an entity right there that could support their work. We also, through conversation this morning, some of our school districts have been taking advantage of the free resources that have been made available within their communities. Unfortunately, I have to report to you that in some of those instances, the tests haven't come back until 5 or 7 days after testing, which that then is not as efficient as we would like it to be. And so
is that because of the back end to the lab issue, or was that administrative? Like, I'm trying to think here, and I really am just making sure that in my brain, I've got this laid out. If it's administrative issue, is it just, we're standing up a program with 13 new people to get this working and then completed and done in December? Is that more arduous setting up a new program than going with existing resources and giving someone who's doing testing already the ability to step up by 2 or 3 versus, hiring a PR person and program staff and communication staff? I'm really just trying to figure out if this is going to be the best way to get the teachers tested.
Superintendent Ebert, for the record, what has transpired is, as we've seen across the state, our health system has been stretched, and resources have been stretched as well. And so making sure that we had a reliable source that could guarantee the time turnaround within 24 to 48 hours is important to all of us. So it's not that we couldn't, and that was kind of the due diligence piece is why would we have this program for educators across our state? Why wouldn't we use those pieces? And so working with the health districts, pulling in the data from the various entities that have been providing support. Across our state, it's not consistent. I do know that in the north, and friends that have had experience where it has been a quick turnaround, but I unfortunately cannot report that that's the case across our state, and that's what we're looking for our educators that are serving our 500,000 children. And again, not just educators, but our bus drivers, our food service, our support staff right there that greet families in the building. So this is a complete project that we wanted to make sure was within a reasonable budget. The question has not come up, but I think it's important to add right now, we did ask another entity for what it would cost. And their cost actually was $110 for on-site and then $150 for mail-in. And so as you see this proposal here, it is cost effective given the other outreach that we've made.
If I could follow up on that last piece of information, I actually think that that's really important. I guess my kids are coming home from school. Really important to say, especially several of us were just sitting on the audit committee this morning. And so we're coming in, looking at the best intentions for the bill of goods of how dollars are supposed to be spent, and then looking at the back end about how dollars just don't get accounted for, or programs just don't always work out the way that you hope, even with the best of intentions and even with the smartest people around doing the best work that they can. And so that piece, and also having conversation about how we see costs go up and public dollars not being spent efficiently and transparently if we don't have competitive bidding and if we have people working around the competitive bidding process. So it does help me to say, if you shopped around for offers and this was your best offer, I think that that's really important for the record. It makes a difference for me because I'm not hearing that. And if you have more to add about that, I think that that would be important to add to this legislative record.
We have shopped around for offers, and this is the best offer that we have to date.
Madam Chair, your neighbor.
Mr. Skolnick?
No, I was saying that, I'm sorry, go ahead.
Go ahead.
No, I'm saying we've shopped around, we've worked and looked for the best of every single solution and the most cost effective, and what we've received is the best that we've received to date. And they will always give us the lowest price they possibly can at UMC. This is not about a profit and loss situation. It's about taking care of the teachers and taking care of the educators and the staff and bus drivers and substitutes, et cetera.
Thank you, Mr. Skolnick. So with that, I think I'd like to get a couple of other things on the record with Ms. Ebert, and we might have to have Mr. Skolnick jump in, but I wanted to make sure that we clarify a couple of things. The discussion about all the different superintendents providing a list and that list being sent to the Teachers Health and Welfare Trust that will be doing this work. Ms. Ebert, I'm not sure if that conversation happened with the superintendents, but it would be my inclination that this information that's being shared, if a teacher does not want their name sent because they don't want to participate, they will be allowed to pull their name and not have it sent to the Teachers Health and Welfare Trust.
Thank you, Madam Chair. For the record, Superintendent Ebert, we will make sure that teachers that do not want to participate when they've not just teachers, all staff that do not want to participate indicate with their governing body, their superintendent, to make sure that their information is not provided in advance.
Okay, thank you, Ms. Ebert. And Mr. Skolnick, and to you, what I'd like to hear is that this information will be provided to you, will only be used for testing purposes. It will not be used for any other purposes as far as the Health and Welfare Trust goes. This is going to be a totally separate program. There will be a wall between the testing component that you're being funded for through the state with the other functions of the Health and Welfare Trust. So I just want to make sure that there is a division of those, that there's a wall between those two, and that this personal information will only be used for testing purposes.
Michael Skolnick, CEO Teachers Health Trust. The response is it's totally firewalled off and it has no integration with our Teachers Health Trust data.
Okay, and it won't be, so the answer is it will not be used for any other projects, activities. This is strictly for testing, nothing else.
Strictly for testing and nothing else.
That's great. We appreciate that. And so one of the closing discussions I believe we should have is we always talk about accountability when we do these types of things. And this is a rather unique situation to where state dollars are going into a state budget account, but then those dollars are going to a non-state entity. So Ms. Ebert, as far as talking about the accountability portion of this, having some reporting done, and I believe a number of us that work in this type of area when we're dealing with these types of things, reporting within about a 30-day period is typically custom. So I would want to hear from you, Ms. Ebert, about reporting, and I believe we would want to probably put that in as we move forward with this, that you would be receiving reports on how this is going in the future, and that would be at about 30 days. And then we would be able to evaluate exactly what's going on and be able to update folks. Would that be your intention?
Thank you, Madam Chair. Yes, we would be more than happy to provide you with a report every 30 days as this project moves forward.
Thank you. And we know it takes time to get things going, but we also want to be aware that if there is an issue, since these dollars do have a lifetime, that if there's an issue, we can get it addressed quickly. And the only way we're going to do that is if we have that conversation. The next question, Ms. Ebert, would be in looking at what all is going to need to be accomplished, your thoughts on us processing phases 1 and 2 today, getting the report in 30 days, and then processing phase 3. So if you could give me your insight on that, because phase 3 seems to be retesting, and it looks like most of the work is going to be done at the front end, I think being able to get some information before we move forward with phase 3 might be helpful. If you would just let me know what you think of that.
Thank you, Madam Chair. That's accountability, as many of your members have stated, is important to all of us. And so definitely implementing phase 1 and phase 2 is critical. The phase 3 components, with the key objectives being continued monitoring of participants utilizing the mobile app and provide and administer the testing and retesting. I just want to do a quick, if I may, with Mr. Skolnick. I think that, launching the program, they obviously, want to be able to provide this service as soon as possible, as soon as it's approved. And so my only question to help answer this question that you've posed is to make sure that if there are testing that's happened, Mr. Skolnick, do you see a timeline before 30 days that we would need to jump into phase 3? Or could we meet the expectations of the chair in this body that implementing phase 1 and 2, where we can move forward with, report, and then have this body revisit phase 3?
And define real clearly what you're saying is phase 3, please.
In the packets that
Go ahead, Ms. Ebert.
Oh, I'm sorry.
That's fine, Mr. Ebert. I can go ahead and address that. So it's broken down in our notes as to the phase 1 total was $1,526,200, and then the phase 2 total was $4,687,725, and then the phase 3 total was $7,031,588. So by processing phase 1 and phase 2 and then getting a report, we would be processing $6,213,925 today, receive the report at 30 days, knowing full well that this could be a 15-day expeditious work program, so that as soon as we got the report, we could schedule a meeting to be able to go over the report and then look at phase 3. So that's what that would encompass, Mr. Skolnick.
Okay, phase 3, can I ask a question? It's Michael Skolnick. So
Yes.
with phase 3, when you're talking about retesting, correct?
That's what we have in our notes. Yes, is retesting based on symptoms and monitoring, and also some administration costs.
Some retesting will occur almost within 10 days after somebody tests positive. Some retesting will occur later. So as from a phase perspective, I'm fine with putting the payment for that testing off for 2 weeks. However, we will be doing retesting of members based on appropriateness of, recipients.
And we would not want to hinder you in the work that you need to do. We want you to get everything done that you would need to get done. This is just more of a send some of it out, get a report back how things are going, and then send the rest out and see how we're doing. So that's one of the things that IFC typically will do, is portion out the first half, get a report, and then portion out the second half so that we have that accountability measure.
That's fine with me. It's important to know that retesting and testing are part of a continuum, and we have the app and a lot going on simultaneously. So I'm fine with that. Reporting comes weekly, so you will always know the status of where we are and how the testing is going.
Thank you very much. We appreciate that. And that way we can monitor it from there. And who knows, you might need to come back and actually ask for more money, but I think you'd probably have to talk to the governor first about that. So with that, committee members, are there any other questions?
I have one, Madam Chair. Senator Gocochia.
Senator Gocochia?
Thank you, Madam Chair. And I guess my concern is, if this program is approved, and again, I'm all in favor of it, but we've already got schools in Northern Nevada that are open, and a number of them are proposing to be open next week. Are we going, if this program is approved, are we going to focus on those schools and getting those tested? Especially when we start talking about a 48-hour turnaround, it'll take at least 12 to 24 hours just to pull the test and get it couriered to UMC. Response?
This is Felicia Gonzalez, Deputy Superintendent for the record. Yes, so we do realize that schools are opening. And so once again, Michael Skolnick said that we can do up to 4,000 tests a day, that they have the capacity to do that. So once again, we will, the Teacher Health Trust and the TIES program team will work individually with each school district superintendent to schedule out when they would like the testing to occur. So it has to be scheduled, and it's going to be about also finding a location for the testing, et cetera. So they're aware that this testing is coming their way, and thankful for the program as well. So thank you for saying that you're supportive of the program. So yes, and I know that Michael Skolnick and his team will work quickly to, once everything is approved, to schedule this out to get teachers that are currently in person tested.
I thank you. I really appreciate that, because we should have a real test case on it. Just because, I like to say they're in school, and I know Elko, Humboldt, and a number of them are going to open next week. So it would be beneficial to have those tested. Thank you.
Thank you, Senator. Other committee members, any other questions or concerns? Not hearing any, so it would be the chair's intent to go ahead and process this work program with the amount of $6,213,925, and then look forward to a report in 30 days. And hearing Mr. Skolnick say they're available weekly, we might even be able to get more information quickly. And also, there's some other, because the money is going to a non-state entity, we would want to make sure that we have the accountability on that side. So are there any other questions from any other committee members before we process this?
Madam Chair, can I ask one
Madam
more
Chair?
question?
I think I had Ms. Ebert.
No, Dr. Titus has the question.
Oh, Dr. Titus, yes.
I'm sorry. So you keep mentioning going to a non-state entity, and are you referring to UMC at that point as a separate entity, or what non-state entity are you referring to?
Oh, to the Teachers Health and Welfare Trust that's running this program.
Okay.
Because
Right.
they're not in our budget, so they're a non-state entity.
Okay, but then they're going to then use the money with a state agency, correct?
The money is going to the Department of Education Teacher Effectiveness Program. So the money is coming from the CARES Act into the Budget Act, and from the Budget Act to the Teachers Health and Welfare Trust to run the program.
Right, and then they're spending it via the state program with the UMC, correct? So it's all a big circle?
UMC's county hospital. So they have, and then they take the money that they're getting and they're contracting with.
Right, okay, all right. Thank you, just for the clarity.
But the Teachers Health and Welfare Trust would almost be considered like a fiscal agent, because they will be the ones ultimately receiving the money and being responsible for it. So that's why we refer to them as a non-state entity.
All right, great, thank you.
Okay.
Madam Chair.
So I want to make sure we know what we're doing. Senator Kika.
Thank you, Madam Chair. And based on issues that we've had recently with the number of unemployment claims being filed for public employees, I just wanted to make sure that there's something in the contract with a third-party vendor that prohibits the use of all of these teachers' identities for any other purpose, whether it be marketing or sales, and then that this list will not be sold or made available for any other purpose by the third-party vendor as well.
I believe Mr. Skolnick made that pretty clear, that this was strictly for this program and only this program.
Yeah, I heard him talk about that specifically within the confines of of his organization, not the third party vendor specifically that was being contracted with.
Mr. Skolnick?
It's totally firewalled off. Nothing in any of our contracts allows for sharing of data beyond with those who we're reporting results to. So that's.
Okay.
Thank you, Madam Chair. Thank you, Mr.
Thank you. Thank you, Senator, and thank you, Mr. Skolnick. We always want to make sure we get everything on the record that we need to. So are there any other questions from any other committee members at this time on this particular item? If not, I would go to Senator Woodhouse to make a motion on this item.
Thank you, Madam Chair. Regarding agenda item C1, I will move that we approve funding for phase 1 and phase 2 in the amount of $6,213,925, that the Nevada Department of Education would come back to IFC later for phase 3 funding, and also that the Nevada Department of Education would provide 2 LCB fiscal staff with the monthly, and if earlier than that, great. But the monthly activity and expenditure reports that are being submitted by the Teachers Health Trust for the TIES program in order to provide that information to us as members of the IFC.
And also NRS 218G 450.
Yes. That the Legislative Commission, as it is authorized to direct the legislative auditor to conduct an audit of a non-state entity that receives an appropriation of public money by entering into a contract to receive public money to carry out a public program. The Teachers Health Trust is subject to an audit by the legislative auditor as directed by the Legislative Commission. And this audit would encompass all books, accounts, reports, or other information that the legislative auditor determines necessary to conduct the audit that is directed by the Legislative Commission.
And for clarification, committee, this is typical language that we put in whenever money leaves state hands and goes to a non-state entity. It's usually done within the Budget Act or the Appropriations Act. But because it's being done separately here, we want to make sure that that's noted along with it. This is nothing unusual. It's what we normally do. But because we're doing this separate from that, we wanted to make sure that it was noted. So with that, I have a motion from Senator Woodhouse. And do I have a second?
I'll second, Madam Chair.
Okay, I have a second from Dr. Titus. Questions or comments on the motion? Hearing none, seeing none, I will go to Mr. Kompotic to call the roll, please.
Assemblywoman Benitez Thompson.
Yes.
Assemblyman Frierson.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Howdigi.
Yes.
Assemblyman Kramer.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Neal.
Yes.
Assemblywoman Spiegel.
Yes.
Assemblywoman Monk.
Yes.
Assemblywoman Swank.
Yes.
Assemblywoman Backus.
Yes.
Assemblywoman Titus.
Yes.
Assemblyman Roberts.
Yes.
Chairwoman Carlton.
Yes.
Senator Brooks.
Yes.
Senator Kinsella.
Yes.
Senator Dennis.
Yes, sorry.
Senator Goycochea.
Yes.
Senator Kiefer.
Yes.
Senator Parks.
Yes.
Senator Settlemeyer.
Yes.
Vice Chair Woodhouse.
Yes.
Motion passes.
Thank you, Mr. Kompotic. So with that, we can go ahead and move on to item number 2, Department of Health and Human Services, Public and Behavioral Health, Office of Health Administration, addition of CARES Act fund money to support 5 temporary contract personnel through the end of this year to assist with program and implementation on contact tracing and tracking project. So with that, if I could have the presenter please queued up and give us a brief overview, and then I believe Senator Dennis was going to open up with questions.
Good afternoon. For the record, my name is Debbie Reynolds, Deputy Administrator with the Division of Public and Behavioral Health. With me today is Deputy Administrator Julia Peak and Aaron Williams, our Chief IT Manager. This work program requests the addition of CARES Act relief funds through December 30th, 2020 to support statewide COVID-19 contact tracing and tracking, or CTT. The primary purpose of the statewide CTT system is to develop statewide integrated laboratory testing and COVID-19 surveillance and contact tracing to mitigate the spread to cross jurisdictions. The CTT system is comprised of 2 main parts, licensing and software development. The Salesforce licensing was purchased through Carasoft in state fiscal year 20 and was funded with CRF funds in budget account 3219, which is the Office of Public Health Investigations and Epidemiology. The software development is provided through the Deloitte contract and is funded with CRF and ELC COVID grant funds in budget account 3219. As part of the Deloitte contract, staffing for contact tracers were hired to assist local jurisdictions with the backlog of work with the increase in the number of positive cases. This contract also included a requirement for Nevada to provide project management. This specific work program funds 5 Information Technology Master Services Agreement contract positions that support the state's efforts to implement and manage CTT. DPBH chose to manage the IT portion of the CTT project out of the Health Administration budget because these contract staff will be managed by the division's IT manager, who is in this budget account. DPBH IT support is vital for the success of the COVID-19 CTT project. The responsibilities of these staff include managing system implementation and project deliverables to ensure that the system meets Nevada's disease investigation and contact tracing needs, vendor management, including change management and budget monitoring to ensure vendor accountability, managing simultaneous efforts during the fast-paced project implementation, including onboarding 650 Nevada agents from multiple jurisdictions, training, which also includes development of training materials, system customization, data validation, data import-export, and supporting both federal and local jurisdiction reporting requirements. The positions also work collaboratively with epidemiology subject matter experts and from local jurisdictions to prioritize system enhancements and new functionality, and technical support duties, including implementation support for ongoing use by the 650 Nevada agents accessing and using the system. Onboarding efforts to bring new lab companies into the data source for CTT continues, as there is a significant backlog of lab companies waiting to come on to the CTT system to do electronic transmission. These staff are also necessary to review system logs to mitigate errors and ensure proper data transmission. I would also note there's been an 8,200% monthly increase in the number of labs when comparing pre-COVID January 2020 to July 2020. But I would state that there is currently no backlog in actual laboratory test results. Ultimately, we need these positions who are experts in technology to provide vendor accountability and assurance that the CTT project meets our needs. Without them, we have public health positions trying to hold an information technology vendor account. With that, we're happy to answer any questions you might have.
Thank you very much. I will go to Senator Dennis.
Thank you, Madam Chair. And I got quite a few questions. Hopefully I answered some of these, but I want to start with the how it actually works. So my understanding is you got CTT, which is Deloitte developed, right? Is that a off-the-shelf product that they customize?
Hi, I'm Erin Williams, IT manager for the division. CTT, the contact tracing portion of that, yes, it is. It was a already off-the-shelf system developed on the Salesforce platform.
Okay, so so my understanding, so you've got CTT, which is the software. You've got IBET, which is that the interface? Is that right?
No. I'm sorry.
Okay.
No, that's a separate tool that is included in the software agreement.
So what does it do? What does the IBET do?
Hey, everybody, Julia Peak for the record. To answer your last question on the IBET solution as well. So we have made many modifications to the contact tracing portion of the tool. We've added additional questions and variables. We've also built out the case investigation portion of the tool, two aspects of the disease investigation. The IBET solution is for businesses, and we have that right now through the NV Health Response website, where businesses can self-certify their support to adhere to the directives that the governor set forward.
So, okay, great, thank you. I was looking, part of this has to do with the licensing. You had, I think it was 20,000 licenses, user licenses. Is that for the contact notifiers?
We don't have that many licenses. I think it was 250 licenses initially. We're going to need to buy more licenses to have up to 650, I believe is our latest number. That may need to grow based on the staffing that we have to hire to address the caseload in each county. Each individual will need their own license to access the system.
So then how many would you need?
At this point, we're projecting 650 that we'll need in total.
So
we initially budgeted, sorry.
No, go ahead.
I think we had initially budgeted for 450, but we've had such great interest in the tool that we now have the tribes coming on board as well. So we need to purchase additional licenses on their behalf. And then, as you know, with the increase in cases, we've brought on more case investigators and contact tracers than initially planned. So we just need the number of licenses to align with the employees.
So, but in the material that we got from you on under the CTT project manager, the two positions, it talks in there about onboarding and training of contact notifiers, over 20,000 user licenses purchased. Is that accurate?
Julia Peak, for the record, I would think that would have to be a typo. That's not the number of licenses that we need for the project.
Okay, well, yeah, that's just, I'm just going off the material that they gave us. And then I think, okay, well, it sounds like you've got enough there. I thought I had one of the other ones I think you already referenced. Talk a little bit about the privacy rights and how you guys are going to ensure that you're protecting Nevada.
Erin Williams. We worked through making sure that they met with the state security requirements, and that security, as you know, is an ongoing effort that we have to address and make sure that every aspect of the system meets security requirements, but we use that as the baseline. In addition to that, we work with the vendor, with Deloitte, as well as our privacy officers for the division to ensure that the training that was being provided for the contact tracers as they were being onboarded met state security standards.
I also wanted to ask, so you've got some of these positions, you've got a call center, and then you've got the contact notifiers. So how does the call center, I mean, what are the hours for that? How does that part work?
So the call center, I'm sorry, Erin Williams. The call center is a contract through Deloitte, and they've hired contact tracers that access the call center system.
So somebody, who is calling them? Is that?
They can get calls. They're provided information that they're doing the contact tracing for.
This is Julia. I can add just a little bit more on that. So we reach out to the close contacts that are identified as a result of the contact tracing and case investigation. If they do not answer their phone, we provide them the information to call the call-in center, and then they would be triaged to the next person so that we can conduct the interview and get that person on quarantine. So we track not only the outbound communications that occur each day, but those inbound communications. if the individual does not answer and or does not call us back, we call them back.
So what are the hours that they can call?
So we have the call center open from 8 a.m. to 8 p.m. 7 days a week, including holidays.
Okay, and then how long do you think these? So on these positions that you're asking for, how long do you think you'll anticipate that those will be required for?
Based on how we've used them to date, I see them being on board for as long as we're addressing COVID. So it's going to be until we run out of money. As you know, with ELC, that's the duration of 30 months or until the funds run out. So we plan to keep them on board as long as is needed.
And then just on the piece that the CTT, Deloitte has already finished developing that's ready to go.
Yeah, the contact tracing, we do make minor modifications occasionally. So I do want to say it's a work in progress. As we get new questions requested from our federal partners, or we feel that we need to add new questions, we'll be adding those in real time. Contact tracing is done. Case investigation is as done as we're ready, and it's in the pilot stage right now for the first zip code. If everything goes well with testing, it'll be rolled out to the rest of the state, but both are final draft unless there's additional edits.
So these positions that you're asking for are going to have access to all of these. So they're going to be able to do all the things that they need to and have the software available to do that.
Correct. Yeah, the plan that we put together and in front of you would be all that we expect we would need to complete the project again until we run out of funds.
Great. And then on the help desk, who uses the help desk?
All the users. Or go ahead.
So currently the help desk position is doing all of the onboarding. It was transitioned from Deloitte to us as the state agency. And so they work and they're bringing on all of the users of the system currently. And then in addition to that, they are going to be building the calls and that and helping the end users within the support of the system.
So I'll just have this is Julia Peak. So unlike the call center that's staffed through Deloitte, who's going to be taking calls from cases and contacts, that call center is taking calls from our users. So the 650 people that we need licenses for, as they experience problems, that help desk specialists can support their needs.
Great. And then what are the hours for the help desk?
For our help desk, it's from 7:30 to 5 currently.
Okay.
Monday through Friday. Well, actually, we have 7 days a week.
7 days a week, 7:30 to 5 every day.
And on the weekends, it's 8 to 5.
Okay, thank you. Madam Chair, I believe that's all the questions I have for now, at least. Thank you.
Thank you. Thank you, Senator Dennis. I appreciate you digging into that. So with that, I believe I have Ms. Spiegel next in line with a question.
Thank you, Madam Chair. I was wondering if there's an anticipation that the help desk will also be providing services to people in multiple languages, and are they geared up for that?
The help desk is working. Currently, we don't offer multiple languages on the help desk component of this. They're working with the jurisdictions locally for the 650 users within the system.
And if your question, this is Julia Peak, switching for the record. If you're asking about our cases and contacts and the Deloitte call center, they do hire bilingual staff, specifically English, Spanish speaking. We also have purchased language line services should that be needed, and it's not Spanish, that's the language of preference.
Okay, thank you.
Thank you, Ms. Spiegel. And I believe next I have Dr. Titus.
Thank you, Madam Chair. Ms. Peak, how are you? Good to see you again. I have a question regarding these folks and the turnaround time and the contact, because their job is contact tracing. And will these 5 new positions lower the time it takes to, when you have a positive test notified to the state, will they be able to contact them quicker? And that's my number 1 question. Number 2 question, what's the current time turnaround from the time you are notified of a positive test that somebody actually is contacted. And the third question I have is a lot about the foreign language thing and how many do speak a foreign language, not on maybe the call center, but I think it's critical that they can speak in the language of the person that is affected to dispel any fears of sharing information. It's a huge issue in my communities, especially with Hispanic workers. They need to have trust in the person calling them. And I need to know if that's improved. My last case, it was quite a delay in the person coming in to make that call to that person. They needed somebody to speak Spanish. So can you clarify those three for me?
Julia Peak, for the record, I'm going to do my best, and if I missed any of those, if you could repeat, I'll start with the last one first, related to foreign language. So we've made great success, specifically, I'm going to say, through the Nevada System of Higher Education resources. UNLV has been able to hire a huge number of case investigators that are bilingual. And if it's okay with the committee, I could provide the list of languages spoken. It was a long list and it was very complete. So that's
Great.
A resource that we have as a state through UNLV. We've used them if we've had to translate things as well. So I hope the foreign language piece has been addressed, both through the language line option, but also through direct hiring and recruiting of folks who are bilingual in as many languages as we can. Notified, well, I'll do the first one then. Will the help desk be able to support timeliness of contacting cases and contacts after we get the lab receipts? They will not necessarily be the ones addressing that. However, I'll say this group of people that we've hired to support contact tracing and case investigation are helping with issues we've had with laboratory ingestion, not only into our NEDS-based system, which is our communicable disease registry, but also looking at issues for the Southern Nevada Public Health Lab, who uses a different system. So they're helping with issues that have caused delay related to the ingestion of data, which has been an issue. So I'll say they are, but not directly with the case or contact. They are upstream to the issue. And then how is the timeline of notifying positives and contacts? Was that the correct wording of that second question?
Right. I'm just, how does it take from the time you get a notice? When is the average time that somebody's contacted that they've tested positive?
Okay, Julia Peak, for the record, great question. It varies based on the county. For the most part, they are able to meet the 24 hours, but it's a modification. Many of them, specifically in Washoe and Clark, are doing sort of a two-part notification of cases. In Clark County, if there's a phone number provided on the lab requisition, they get a text that says you have a confidential message from the health district, and then they're able to log in and see that message. And then as soon as it's possible, somebody from the health district or a vendor-based case investigator calls that individual. So I think it was in the 90%, but happy to provide that specific number if it's helpful. For Clark County. In Washoe County, they've also adopted a two-part investigation for the cases. And so once they get the lab receipt, they immediately call the case and do a very preliminary notification where they let the individual know they've tested positive. They need to isolate in some basic information about what that looks like. And then as soon as it's possible, again, somebody calls for the full case investigation. It's a very long investigation, as you can imagine. And so we prioritize that in two steps. In the rest of the state, I think they do and can confirm they do the full investigation. For the most part, I've heard that they're meeting the 24-hour goal that we've set for ourselves to investigate cases. Once they have developed the list of their close contacts to those cases, they send it to the Deloitte team, and the Deloitte team contacts or attempts to contact that individual the day it's received. And then, as I mentioned earlier, if they don't answer, we leave a message. If they don't call us back, we continue to call them throughout the following days.
Great, thank you. Thank you for that. And thank you, Madam Chair.
Welcome, Dr. Titus. Are there any other questions at this time? I had not had anyone reach out as far as the question goes. So any other questions? Hearing none, seeing none. Senator Dennis?
I would make a motion that we approve the positions. I don't know if we need any other language in there, but that we would approve this.
I think we're good with just approving the work program. So I have a motion from Senator Dennis. Do I have a second?
I will second.
Second from Dr. Titus. Questions or comments on the motion from any committee members? Hearing none, I would ask Mr. Kompotek to call the roll, please.
Assemblywoman Benitez Thompson,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Levitt,
Yes.
Assemblywoman Howdigy,
Yes.
Assemblyman Kramer,
Yes.
Assemblywoman Monroe Moreno,
Yes.
Assemblywoman Neal,
Yes. Can you hear me?
yes. Assemblywoman Spiegel,
Yes.
Assemblywoman Monk,
Yes.
Assemblywoman Swank,
Yes.
Assemblywoman Backus,
Yes.
Assemblywoman Titus,
Yes.
Assemblyman Roberts,
Yes.
Chairwoman Carlton,
Yes.
Senator Brooks,
Yes.
Senator Kinsella,
Yes.
Senator Dennis,
Yes.
Senator Goycochea,
Yes.
Senator Kiefer,
Yes.
Senator Parks,
Yes.
Senator Settlemeyer,
Yes.
Vice Chair Woodhouse.
Yes.
Motion passes.
Thank you, Mr. Kompotek. So we can move on to our next item under C is number C3, Department of Employment Training and Rehabilitation. Workforce, I believe we'll have Ms. Caffaretta available for this item.
Yes, thank you very much. Can you hear us?
Yes, I can. Thank you.
Great, thank you. This is Elisa Caparetta, Acting Director for Dieter. I am joined by my team here, Chris Sewell, David Schmidt, Chris Nelson, Kitty DeSocio, and Carlene Johnson. And we're here to present the work program on the Workforce Innovation and Opportunity Act. I'm going to turn it over to Chris to give you the summary.
Thank you. For the record, Christopher Sewell, Madam Chair and members of the Interim Finance Committee. The purpose of this work program is to align state budget authority with additional authority from the Workforce Innovation Opportunity Act, also known as WIOA, in order to have sufficient operating expenditure authority for the remainder of the state fiscal year 2020. This funding is administered through statewide activities and is also passed through to designated local areas to provide training and the other reemployment support initiatives to meet the objectives of WIOA. The amount of this work program is $1,164,000. Madam Chair, we're available for any questions the members may have.
Thank you, Mr. Sewell. I'll go ahead and open it up. I believe Ms. Monroe Moreno had a question.
Thank you, Madam Chair. Yes, I do. I understand that everything as far as workforce in our state has been put in disarray with COVID-19. But my question is, why were the local workforce development boards costs charged to the client services category funded with wage assessments rather than seeking the approval of the Interim Finance Committee to align the Federal Workforce Innovation and Opportunity Act grant authority to properly fund these expenditures?
This is Kitty DeSocio, Chief Financial Officer for the Department of Employment Training and Rehabilitation. We paid those invoices out of Category 12, which was the subcategory, so that the boards could close their books, and we needed to process those invoices in a timely manner. We intend to fully journalize those invoices and the related expenses to Category 11 where they belong after this work program has been approved.
And as you look and as we make it to the end of 2022, do you anticipate having to come back to the interim finance committee for additional funding, or do you feel that this will be enough to get you through the end of this year?
This particular work program is for the year that we basically just closed. It's for state fiscal year 20 through June 30th, 2020. And I do not anticipate, Christine can speak to that even further, but I do not anticipate coming back in 21 and asking for any more authority within this budget.
Thank you, Madam Chair.
Thank you, Ms. Monroe Moreno. So if I could just expand on Ms. Monroe Moreno's question, IFC has met an inordinate amount of times. I mean, there have been plenty of opportunities to come to IFC and talk about this. And with everything that's been going on, we're very cognizant of wanting to make sure that we understand how all these dollars are being accounted for. So to use them and move them and then come later to do the adjustments, what was the time concern?
Again, for the record, this is Kitty DeSocio, Chief Financial Officer for Dieter. We had to make sure that we had the bills were being paid accordingly and that the boards were able to close their fiscal year. I apologize for the delay. We are extremely inundated with a plethora of requests, and we are doing the best we can. And I don't anticipate this being a practice going forward, and I do apologize for that.
And we appreciate everyone's working under a different level of different workload level now. We all are. So we do appreciate that. It's just, you know, history in the past, there has been some issues with some of these work boards. So I'm always a little exceptionally very cautious with these, with the boards, because we have had issues in the past. So I just want to make sure that everyone's aware of how the money is being accounted for and that we don't end up with a problem in the future. So thank you. Are there any other questions from any other committee members at this time? I don't believe we have any other questions from any other committee members at the moment. Ms. Monroe Moreno?
Madam Chair, I move that we approve this work program.
Okay, I have a motion from Ms. Monroe Moreno. Do I have a second?
Woodhouse will second.
Thank you, Senator Woodhouse. Any questions or comments on the motion? Hearing none. Mr. Kompotek, if you could call the roll, please.
Assemblywoman Benitez Thompson,
Yes.
Assemblyman Frierson,
Yes.
Assemblyman Levitt,
Yes.
Assemblywoman Howdy,
Yes.
Assemblyman Kramer,
Yes.
Assemblywoman Monroe Moreno,
Yes.
Assemblywoman Neal, Assemblywoman Neal,
Yes.
Assemblywoman Spiegel,
Yes.
Assemblywoman Monk,
Yes.
Assemblywoman Swank,
Yes.
Assemblywoman Backus,
Yes.
Assemblywoman Titus,
Yes.
Assemblyman Roberts,
Yes.
Chairwoman Carlton,
Yes.
Senator Brooks,
Yes.
Senator Kinsella,
Yes.
Senator Dennis,
Yes.
Senator Goycochea,
Yes.
Senator Kiefer,
Yes.
Senator Parks,
Yes.
Senator Settlemeyer,
Yes.
Vice Chair Woodhouse.
Yes.
Motion passes.
Thank you, Mr. Kompotek. So that concludes our business under item number C. We'll go to item D, which is request for an approval to accept gifts and grants from the Department of Public Safety. So with that, I believe I'll have Mr. Luna as our presenter.
Yes, ma'am. Thank you. Good afternoon, Madam Chair and members of the committee. For the record, my name is Justin Luna, Chief of the Division of Emergency Management within the Department of Public Safety. I'm joined today by Lieutenant Colonel Brett Compston from the National Guard Joint Operations Center. He's been serving as the incident commander for the State Emergency Operations Center emergency response to COVID-19. Also joined by the division's Administrative Services Officer, Arsenio Escudero. The division is the administrative agency responsible for coordinating disaster assistance through Fema. As part of the major disaster declaration for COVID-19 pandemic, the division, in coordination with the Nevada National Guard and the State Department of Health and Human Services, is requesting additional FEMA grant authority to continue the response and recovery efforts. The acceptance of this grant provides for the authority to continue emergency response operations, including ongoing SEOC operational costs, additional temporary contract personnel for warehouse support, and public information efforts and long-term planning. We're happy to address any questions you may have. Thank you.
Thank you very much, Mr. Luna. Thank you, gentlemen, for being here today. I believe I'll go to Senator Brooks. I believe he has a question.
Thank you, Madam Chair. This is about the stockpile and the warehousing. In addition to the state stockpiles, what other local jurisdictions in the state are developing a stockpile of their own inventory of PPE?
Yes, sir. Through you, Madam Chair, to Senator Brooks. This is Justin Luna again for the record. We've gotten reports from local cities, counties, and tribal partners throughout the state that they are building up their own supplies of PPE to help with surge demand that we anticipate in the fall. So we do not have reporting on how much each county, city, or tribal jurisdiction has accumulated or that they're trying to procure, but we've gotten reports that they are working on, many of the jurisdictions are working on procuring their own stockpiles and supplies of PPE, and we have encouraged them to do so. It's a practice that is happening at both the federal, the state, and the local and tribal level.
Thank you. And Madam Chair, is it okay if I ask a few more questions on this subject?
Sure. Go ahead, and then I have one other person after you, and I think we'll be good. Go ahead, please.
Oh, okay, great. So does the agency anticipate the warehouse, the SEOC, and the JIC support services will be needed beyond the end of the year, beyond December 31?
This is Justin Luna again for the record. We do anticipate at this time that those services will still need to occur. However, we're currently going to be working on a plan to be able to fund those services with the CARES Act money set to expire at the end of the calendar year. There is an opportunity. It's our understanding that the FEMA Public Assistance Grant will be available after the first of the year for emergency protective measures and eligible expenses under that grant. However, meeting the 25% match requirement is something that we are going to be working with state purchasing on and the governor's finance office on to develop a plan on what service levels might look like after the first of the year to be able to continue to support these efforts.
Thank you. That actually answered my next question as well.
So are you good, Senator?
Yeah, unless we would like them to expand upon how they're going to get that 25% matching funds. You said working with state purchasing, but
They may not want to tell us their secrets right now. Somebody else may try to go get that money before they do. But Mr. Luna, if you'd like to expand.
Yes, this is Justin Luna again for the record. So we're gonna have to either, it'll be unless Congress at the federal level acts and provides additional federal assistance that, similar to the CARES Act money, can be used to meet those match requirements. We're coming to the state and the Interim Finance Committee to determine, so that's where we'll be working with the Governor's Finance Office and try to come up with a proposal of what service levels we might be able to maintain and what the cost share would look like, and if the state would have any state general fund dollars or additional funding streams to cover that match to continue the emergency response operations. Because we really don't know what this is going to look like towards the end of the year. We anticipate that it's going to be another surge when it's combined with the flu season. But again, uncertain what the hospitalization numbers and the positivity rates might look like after the first of the year.
Thank you, Mr. Luna. Might want to think about that general fund part of that conversation a little bit, but other than that. So with that, go ahead and go to, not that I'm saying no, I'm just saying be careful. I believe Senator Kickebetter had a question next.
Thank you, Madam Chair. I promise I'll be quick. Our staff prepared a sort of a spreadsheet that indicated how much of each type of PPE was going to be available based on the 30-day stockpile purchase, and it doesn't matter. We ordered a 60-day stockpile purchase in June, and the 30-day purchase is not half of the 60-day purchase. So I'm just trying to figure out the math in terms of how we're calculating those quantities.
This is Lieutenant Colonel Brett Thompson, serving as the incident commander for EM. But in actuality, we've acquired or have.
We can't hear you. We're having a hard time hearing you, sir. If you could get closer or.
Hear me now, ma'am? Can you hear me now, ma'am?
It's a bit better, yes, thank you.
So this is Lieutenant Colonel Brett Thompson with the Nevada Guard. I've been serving as the incident commander for the last matter of 3.5 months. In actuality, sir, we have acquired, or not acquired, but we have ordered a 120-day stockpile that we expect all that to be delivered by the 1st of October. And so portion of that, half of that, the $49 million worth of that, was actually CARES funded. The second portion of that, the second 60 days, is being funded through a combination of 25% CARES money and 75% FEMA PA reimbursement. And then the money that we are asking you about today, at least the PPE portion of that, the 30 days, is really, it's a hedge against what we don't know will happen in the fall, but we expect to happen. We expect there to be some sort of a resurgence once we have a flu, COVID mixed environment. And that 120-day stockpile, we really don't want to get into that until the December timeframe, because that CARES money expires and had to be spent by the 31st of December. So all we will have after that is FEMA PA money. And so this money, or the authority that we're asking you for today, we've already received the 25% CARES portion of that. This is really, we're asking you for the 75% authority to bring in the FEMA grant money that we would use for any emergency PPE between now and when we would have to really break into that stockpile in what we hope will be what we hope doesn't happen, essentially. Does that make sense, sir?
I think so. So the 91.3 million gloves, or so 93.6 million gloves that you have on hand is actually 160-day stockpile, not a 60-day stockpile. Is that accurate?
The 120 days. So we have ordered a 120-day stockpile of
120, sorry.
gloves,
Thank you.
masks, gowns, face masks, tappers. Basically, we do not want to find ourselves in the situation we found ourselves in March, where stuff essentially ran out about a week and a half.
All right, I appreciate that. That's why I couldn't get the math to work. Thank you.
Yes, sir.
Thank you, Senator. And it's my understanding that this is basically more along the lines for the medical field. This isn't a general provision for the general public. This is more to make sure that health professionals and those that are going to be on the front lines in some way have PPE available to them. Is that correct?
Yes, ma'am. The calculation for this 30 days that we're asking for is we used our worst rates in April for the full hospital system, as well as the public health system, the skilled nursing facilities, the alternate care facilities, and our first responders. So it is public health and the hospital systems, not general public.
Thank you. And the hospitals are still, and other medical centers are still required to go out and purchase their own PPE right now if they can get it. This is just a backup in case they can't get enough of it fast enough.
Yes, ma'am. This is the worst case.
Okay. All right. So they're not thinking that we're providing this for them. They still know that they need to go actually out and purchase their normal supply that they would normally do.
Yes, ma'am. And the report we received, I believe it was yesterday from the NHA, showed that a good number of hospitals have somewhere between 2 weeks and a 30-day supply on hand right now. And obviously they're continuing to build that. So between what hospitals have, what local counties are building, what we are building, and what our federal partners are building, we should be able to withstand even the worst case if it lasts for multiple months this winter.
Okay, that sounds good. Thank you very much. I appreciate you clarifying all the points. Committee members, are there any other questions at this time?
Madam Chairwoman?
Dr. Titus.
Thank you for a question. I actually have a couple. Can you tell me what the total amount of money has been spent on stockpiling these PPE? Not including the 7.9 you're asking for right now?
So I believe at this moment, ma'am, we have, I can't give you the exact total, but I know towards the stockpile, we have expended approximately 56 million and change that we have ordered against that 120-day stockpile.
So you about 56 million already spent plus change, and this is an additional 7.9 million, correct?
Yes, ma'am.
Okay. So you don't just have, I want to make sure this is clear. You don't just have a 60-day stockpile. You currently have a 120-day stockpile it already in warehouses somewhere.
We have a 120-day stockpile on order, not on hand. And this is
I'm sorry.
Oh,
The
yes,
number, you determined that you have 120-day supply based on the maximum daily use of the worst case, worst day in April. Is that how you've done your calculations?
Yes, ma'am. We produced it's called the Disease Outbreak Management Plan. I believe we produced it in late May. And so we used the calculations were based on the worst burn rates that we saw in April.
And according to the documents that were submitted, you had some pretty significant delays in actually receiving the PPEs. Are we going to have delays in this additional supplies that you have ordered, or have you already gotten a promise on those?
So the 56 million that we have contracted for thus far, those are all in progress. Some has been received, some is in shipping, some we actually bought production line stock, so it will come over a certain portion per month out through the end of the year. So yes, the answer is it is a delay, and we had to start early on that to be able to acquire that stockpile in preparation for the fall.
Right, and I addressed this question the last time this issue was presented to this committee, and I'm going to ask it again regarding the warehousing. These items have a certain shelf life, and as you stockpile them and you put them in a warehouse location not to be disclosed, and I understand that, it's the warehouse folks that part of this request for is to actually pay for warehouse employees. Are they in there kind of moving this stuff around, checking out dates, making sure the mice don't get into it? I mean, I'm just concerned about, I just vision warehouses full of very important items that frequently the public can't get because people have stockpiled, say, for example, toilet paper. Are we doing that? Are we taking stuff off the market, throwing it into a warehouse that then nobody gets to use because we've stockpiled now 100 and we have 120 days, we're going to get another 30 days worth, so we have 150 days of stockpiling of goods that have a shelf life, and how are you doing it so that we know the inventory is being rotated, and that truly if we need it, and how are you going to give it back if you don't use it, and what's the plans for all of that?
So the state had essentially the equivalent of a state stockpile, just like there was a federal national stockpile when this first started. What we all learned at all levels was that was grossly inadequate. And so as we've gone through this, those numbers have increased dramatically. Most states are building in between a 90 and 120 day stockpile. So we are not alone in our endeavor to be prepared for what may or may not come in the fall. If we get to a certain point where I pray that this happens, that nothing dramatic happens and we don't have to break into that stockpile, there will be a point where FEMA essentially ends the emergency, and any stockpile that we have purchased with the FEMA public assistance funds, we will have to then liquidate. The portion that was purchased under the CARES funds, which is 60 days, will then remain within the state and the state's property, and that will then turn into essentially the long-term stockpile. And that would be the ideal situation.
So you just said that most states have a 90 to 120 day stockpile. I get that, but our state already has 120 days stockpile. Why does our state need an additional 30 days on top of the 120 days?
Yes, ma'am, I understand. So really what I'm asking for here is I'm asking for the authority to allow me to have enough funds that I can basically I can make expenditures between now and December, because that CARES money runs out at the end of December. So we have no more CARES options. And it goes back to kind of the question we were just talking about with the warehouses. There are not great ideas and plans after 1 January, unless the federal government comes to aid the state. We all know the situation that we are in here with state dollars. So we are hedging a bet and asking for this money now for this 1 month worth of PPE, so that if something bad happens, cover those, say, between September, October, and November, we would use these funds and try to save that stockpile until December. That would give us December, January, February, and March in a worst case scenario. And then we would be reliant on our federal partners in April or May or June or however long the situation would happen. I hope that makes sense.
Basically, yes, it does. So what you're telling me is that you're hedging your bet. You're going to have this 30 days as almost a separate stockpile so that we don't have to dip into 120 days, because this money has to be spent now, and we have this money and may not have funds in the future. So you don't want to dip into 120 days. You want to create another stockpile of 30 days so that you can use this up first. Is that what you're saying?
That's exactly it, ma'am. And ideally, I won't use this money at all. We'll return the authority, and that'll be that.
Okay, so you just said that ideally you wouldn't use this money if we did not need to use this money?
That's correct.
Okay, very good. Thank you, Madam Chairman.
And thank you for clarifying that this is just authority. This isn't money that we're actually writing a check for. This is allowing the authority for these dollars to be used. And if they're not used, then they come back. But we don't want to slow the process down if it needs to be done quickly. So committee members, are there any other questions at this time? I guess I would just have one other question. So, Mr. Luna, gentlemen, if we did not use these funds for this PPE and cleaning supplies and the services to the operations center, could these dollars be used for something else? Are they specific to just this issue? Yes, Mr. Luna.
Yes, this is Justin Luna again for the record, and we worked with the governor's finance office to put these estimates together of what we thought we would need. They are estimates and projections. And because during a disaster and emergency, we don't necessarily know what might come up and what we might need at times. And so we may need to use these emergency operations funding to fund other emergency operations costs that we might not have anticipated at this time. But it would be under the FEMA grant, it would have to be eligible for emergency protective measures and eligible for reimbursement under the FEMA grant in order for this us to use this authority. So that would be the only comment that I would make, is that we tried to put together a list of projected expenses that we thought were most appropriate to continue our emergency operations here, but we don't always know what might come up and what we might need in the future.
And we appreciate that, and I'm grateful that you're trying to be prepared. I guess what I'm trying to get to is, since these monies have an expiration date, where is the point of no return to where these dollars might have a higher, better use in another area that may pop up in 2 weeks that none of us are aware of, but yet we've allocated the authority to you. But then hopefully, knock on wood, you won't need to use that authority. How quickly could these funds be turned back around to be used in another area if we needed to do so?
So this is Justin Luna again for the record, and I would say if a need presented itself, that we could probably make an analysis and determine what types of service levels we might have to sacrifice based on our best projections, depending on when the need came up, working with the governor's finance office, but we would be able to identify what available funding we could return. I'd say fairly quickly, within a couple of weeks, we'd be able to do an analysis of what we might be able to return. As Lieutenant Colonel Thompson mentioned, we hope to have the majority of our PPE supplies in by 1st of October timeframe, end of this month for 1st of October. And so we hope to do an additional analysis after that to reassess where we might be at. And depending on the costs that we had to pay for each of the PPE supplies, if we were able to get a better cost than we estimated in the projection, then that would give us a better understanding of what we might be able to return in authority.
Okay, thank you for clarifying, and just wanted to make sure that you're aware that, you know, this is a need in the state, but there are multiple needs for CARES Act dollars in the state. So we just want to make sure everyone knows where their date is to what they need to do and when the money needs to come back to the state so that it could possibly be repurposed for another issue. So I don't think we have any other questions or comments at this time from any other committee members. So with that, Senator Brooks.
Thank you, Madam Chair. I move that we grant the authority to use this item. I need help with the motion.
Senator Brooks moves for approval of item D.
I'll second.
And I have a second from Dr. Titus. Are there any questions or comments on the motion?
I like that so much better.
I'm here for you, Senator. So with that, Mr. Kompotek, if you could call the roll, please.
Assemblywoman Benitez Thompson. Assemblyman Frierson.
Yes.
Assemblyman Levitt.
Yes.
Assemblywoman Howdigy.
Yes.
Assemblyman Kramer.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Neal.
Yes.
Assemblywoman Spiegel.
Yes.
Assemblywoman Monk.
Yes.
Assemblywoman Swank.
Yes.
Assemblywoman Backus.
Yes.
Assemblywoman Titus.
Yes.
Assemblyman Roberts.
Yes.
Chairwoman Carlton,
Yes.
Senator Brooks,
Yes.
Senator Senator Kinsella,
Yes.
Senator Dennis,
Yes.
Senator Goycochea,
Yes.
Senator Kiefer,
Yes.
Senator Parks,
Yes.
Senator Settlemeyer,
Yes.
Vice Chair Woodhouse.
Yes.
Motion passes.
Thank you, Mr. Kompotic. So committee members, with that, our business for today is done. It is exactly 3:30. Good job. This is the time I was aiming for. We will pause for a couple of moments to allow people to call in to the public comment line. So if everyone would be at ease, and at this time, I'd like to say thank you again to Ms. Jones and Mr. Kompotic and everyone on their teams who go through all this and provide us with such great information, and to our broadcast services people who have really gone above and beyond. We've had a lot of IFC meetings to make these meetings possible for us to stay safe and have the public participate. So it is 3:30. We'll give it a minute or two to let the public call in, and then we will resume then. So broadcast services, it is 3:32. Do we have any calls on the public comment line, please?
Thank you, Chair. The line is open and working, but we have no callers.
Okay, well, with that, committee members must have answered everyone's questions that were listening out there. So with that, thank you all very much for your time and attention. And again, thank you, Ms. Jones and Mr. Kompotic and your team for all of your hard work. We are adjourned. Everyone have a nice evening. Thank you.
Thank you, Madam Chair.